It's a convenient alternative to primary care visits, and you don't need an appointment. Noble Express Care in Westfield is now open, and I'm going to go inside to get a tour. Now here we are at Noble Express Care in Westfield. Dr. Sutton, it's nice to be with you here on your turf.
Great to have you back, Ashley. Welcome to our new urgent care in Westfield, Noble Express Care. If you look well today.
Thank you.
But if you weren't well today, you'd come here between the hours of 10 a.m. and 7 p.m. on weekdays, 10 a.m. and 5 p.m. on weekends, and we would be happy to see you for whatever ailment you had. Come on into reception, and one of our friendly faces, Anna or Vera, will come greet you. Usually, when you come to Express Care, you're in and out under an hour. It's been about our average since we've been open. However, the last few weekends we've seen a lot of patients come in with cold and flu-like symptoms. We're in the midst of a flu epidemic, and we've had some longer waits because of the crowding and the lack of availability of the patient's own primary care on the weekends. So, but usually there's very little wait here.
But it's a good time to come, especially on the weekends when a lot of people's doctor's offices aren't even open. So it's great to come to Express Care.
Absolutely, absolutely.
Now, when you do come, you go and check in at reception.
Come in with a photo ID and your insurance card, and a copay, which is going to be substantially less than if you went to the emergency department for most policies. And we also have, if you don't have insurance, which is illegal in the state, but under the new law. But if you don't have insurance, we have also a cash schedule as well.
All right, now, Dr. Sutton, you say that obviously the copay is a lot less to come to Express Care versus an emergency room visit.
But that shouldn't be a determining factor if you had a life-threatening chief complaint, like chest pain or abdominal pain. We're not set up to evaluate abdominal pain here at Express Care, and most chest pains I would also direct toward the emergency department.
We spoke with Dr. Jacques Blanchette. He's the chief of the emergency department at Noble Hospital, and he explained when people should go to the emergency room instead of urgent care.
I think patients with complex medical problems, for example, diabetes, or patients on blood thinners, patients on multiple medications, and those patients should probably come to the emergency department, because we can do a lot more in the emergency department, obviously. And we can do studies like CAT scans, we have ultrasounds available, we have MRIs at times, we have the consultants at the hospital also can help us, there's different specialists that work at the hospital. So we can offer that much more than urgent care. We work very well with the urgent cares and the Express Care, and they usually call us if they have a patient that they're concerned about that may need more testing or more treatments than they can do, and they call us, and we're expecting the patients to come to the emergency department, and we can take care of them, and we don't need to repeat everything that was done, and it's very smooth as long as we have good communications, which we do.
Dr. Brian Sutton took me on a tour of Noble Express Care. First stop was the intake station, where they check vital signs such as height, weight, blood pressure, oxygen level, and temperature. Good news, I didn't have a temp. My blood pressure and oxygen checked out great. My height, still the same as middle school. And my weight, I'll tell you another time. Now on to the exam room.
Would come and put you in one of our treatment rooms. This is the procedure room. So if you had an accident on set with one of your culinary experts.
You never know, but now I'll know where to go if I do, right?
A nice long finger laceration, we'd bring you in here.
Okay.
Set you up, and I'd put some local anesthesia in, clean out your wound, and suture you up right here in this room.
So what other type of, I mean, obviously if you have the cold, have the flu, what other type of injuries would people come here for?
Minor injuries. Over the weekend we saw a lot of people who fell on the ice, slipped, and we saw a lot of fractures, broken arms, broken wrists, broken fingers. We had someone with a broken vertebrae we had to send on to the hospital. So, we're well equipped with a digital X-ray, and we see if it's major trauma and you have an ambulance involved, you're not going to be coming here. You're going to be going to the emergency department. So Ashley, you came and visited us during a normal busy work day, and you could see my colleague, physician's assistant Troy Chilson, is busy at work in the physician and provider work area here in the back, right behind reception. We have our medical assistant work area over here, and we're going to now walk over toward X-ray and lab.
So if someone did come in after they fell, they had a broken bone, or they weren't sure, you weren't sure if it was broken, they'd come in here for an X-ray.
I'd order the X-ray, and one of our friendly radiology techs would bring you back here to our brand new digital radiology facility, where we'd X-ray the bone that we need to X-ray, or your chest, or your abdomen, or your vertebrae, or whatever you needed to be X-rayed.
Do you think you may have the flu? We'll take you to the lab where they'll test to find out.
So we're in the middle of a flu epidemic this time of year, and here at Noble Express Care we have a limited laboratory, but we do test for the influenza, the flu virus, and we would use a flexible Q-tip device here, and this would go in the back of your nose. Put your head up, Ashley. We're not going to go all the way back, but we'd twist and get a nice sample. No, if the real I would go deeper like that.
Oh,
twist. Yeah, okay. And then we would run this in a chemical reaction and to see if you have influenza or not. This is not Ashley's swab, but we did have a patient earlier today with flu-like symptoms. We checked him for the flu, and it's strongly positive for influenza A. So we treated that patient for the flu. So Ashley, at the end of your visit, we'll tell you what you have, and we'll tell you what to do. We'll give you some discharge instructions, a prescription if you need it, and we'll make the referral for you to get follow-up.
Wonderful.
Thank you.
So now hopefully I don't have to come back here for any reason, but if I do, I know I'll be in good hands. I'll be taken care of at Noble Express Care in Westfield.
Absolutely.
Thanks so much, Dr. Sutton.
Thanks, Ashley.
Great taking a tour with you.
Thank you.
Noble Express Care is located at 57 Union Street in Westfield. They're open Monday through Friday, 10 a.m. to 7 p.m., and on weekends from 10 a.m. to 5 p.m. If you have any questions, feel free to contact them at 413-642-7200. You can also visit them online at nobleexpresscare.com.